Hi, my name is Taylor Blaine, and I'm going to be discussing adjustment disorders. Adjustment disorders are considered to be disorders that are caused by stressful situations. When someone has an adjustment disorder, they will tend to act more stressed in a situation than what would normally be expected as a reaction. This type of stress will cause this person significant problems with normal everyday encounters such as schools, relationships, and work. The different types of adjustment disorders listed by DSM-5 include depressed mood, anxiety, mixed anxiety and depressed moods, disturbance of conduct, disturbance of emotions and conduct, and unspecified. All the disorders can be seen as related even though they all have different unique symptoms. For diagnosing adjustment disorder, the DSM-5 lists off of Mayo Clinic. Having emotional or behavioral symptoms within 3 months of a specific stressor occurring in your life, experiencing more stress than what would normally be expected, like I mentioned before, and also having following symptoms that are not a result of an other mental health disorder or part of a normal grieving process. The different symptoms occur when a patient has an adjustment disorder due to having a difficult time coping. The different triggers or occasions are too much stress on the person, and according to Mediclam Plus, the medical encyclopedia lists the different types of stressors for people of any age include death of a loved one, divorce or problems with a relationship, general life changes, illness, or health issues in yourself or in a loved one, maybe moving to a different city, and etc. The other triggers mentioned on the site relate more to a younger crowd. This goes along with family problems, school problems, and even sexuality issues. Each person could react very differently to the scenarios and triggers, and with learning techniques and new experiences, this might help the person overcome those triggers. The different types of treatment approaches for adjustment disorders consist of psychotherapy, medications, or both. Mayo Clinic states that psychotherapy, also called talk therapy, is the main treatment for adjustment disorders. This can be provided as individual, group, or family therapy. Many with this disorder find treatment to be helpful as well as only needed briefly. The prevalence in primary care has been stated off of the site Johns Hopkins Medicine by Rachna L.A., M.D., and Dean F. McKenna, M.D., with ranges from 3 to 10% and oftentimes not diagnosed by the general practitioners. The prevalence with patients in outpatient mental health ranges between 5 to 20%. Along with being common with children in response to acting out, and is also equally prevalent in males and females. This is a type of disorder that is often overlooked at and maybe not noticed, and I do believe that if it was more commonly talked about, that maybe it might also be more commonly diagnosed after ruling out other mental health disorders.